Hi, Needle Injury Protector Part 1. Let's review the conventional method. This is a typical conventional cord blood collection bag which has a needle with a light blue color cap. There is certainly a scope to add some mechanical device which could avoid the needle stick injury. As usual, after opening the light blue cap with the twisting action, we could see the white bore needle. You can see the twisting action, and then you'll be able to see this white bore needle. This white bore needle is specially designed for cord blood collection. This needle is potential source of infection by blood-borne pathogens transmitted to the technologist while collecting the blood. Those who are involved in venipuncture or similar invasive procedures are at risk of getting these blood-borne infections. Such injuries should be avoided due to their potential to transmit these bad bugs. The commonest bad bugs which are transmitted are HIV, HBV, HCV, and bacterial as well as fungal infections. Before collection, this needle is not very harmful, but after collection, it becomes extremely harmful. The sources of infections are needle itself. And from technology side, if technologist has broken skin or a wound, or by accident if he swallows the blood, and if the technologist has an open wound which could easily transmit these bad bugs. The most critical part is when needle pricks the skin while invasive procedures like vein puncture or while blood collection. There are high chances of getting such infections. The injuries caused by needle prick are known as needle stick or sharp injuries. The regulations ask continual improvement as far as safety of technologies is concerned. Hence, we have to think how we can perform safe collections. By this conventional method, we have done a good job till date. If we want to estimate the risk of needle stick injuries, WHO has predicted that about 3 million people can be exposed to the needle stick injuries if 35 million technologists are performing the collection. The most common cause of needle stick injury is when we recap the needle after collection. While recapping, usually we might make a mistake due to small bore of the cap, and it's a skillful action to put the needle back into the cap. So regulations recommend to avoid this recapping procedure. Somehow it should be avoided, and that's why nowadays needle injury protector is widely used. We could certainly avoid, but if it's not, there is still one better method to avoid needle injury. Recapping should be avoided with hand. The cap is on the surface. Without touching the cap, we could insert the needle into the cap, so you are not at risk. You can lift it up without touching, then can lock it and then cut it and discard in a white container which is pre-filled with the hypochlorite solution. In scenarios where you do not have a needle protector, you should develop a habit of recapping the needle in this manner. As per Enable recommendations, it's good to go for needle injury protector because it's going to avoid the needle stick injuries. If though the needle stick injuries happens, a protocol should be followed. We should be alert enough to inform the concerned facility regarding the injury. There are so many maneuvers which you can do when if though you are getting exposed to the releasing injury. Then commonest is encourage bleeding from the skin wound and wash the injured area with copious soapy water, disinfectant like Dettol, Savlon, or you can use a scrub solution or a water, plain water as well. We have to report the accident. This is extremely important to report the accident because most of the preventive measures have to be initiated within 1 to 2 hours after we exposed to these injuries. Immediately we need to think to inform and start the post-exposure prophylaxis. After post-exposure prophylaxis, we have to inform and report this accident as early as possible to our toll-free number 1800 103 5353. The person whose blood is transmitted in the technologist, and if the status of that particular person is not known, then we have to start HBV antiglobulin and HBV vaccination. If the healthcare worker is HBV immune, I mean if it's all the vaccination has already been taken, then there is no need to have vaccination. Complete follow-up of the testing course is important for HIV. It should be done by serology testing after 6 weeks, 3 months, then after 6 months, and then after 1 year. Thank you. I hope this is helpful.